Hi, my name is Professor John Dickinson. I'm based at the Marylebone Health Group. I'm an exercise physiologist. Today, I'd like to talk to you about breathing pattern disorder. Breathing pattern disorder is sort of an emerging term at the moment, and you might have heard someone might have said, "Oh, you might have a breathing pattern disorder," but what does that mean? And actually, breathing pattern disorder is it's an umbrella term for lots of different conditions. But what we ultimately mean by a breathing pattern disorder is the movement of your rib cage isn't effective enough to be able to deliver a satisfying amount of air into your lungs. So therefore, an individual may feel that they're kind of short of breath, or they experience early onset of breathlessness, or they experience early onset of fatigue. So sometimes people have breathing pattern disorder by itself, but breathing pattern disorder is quite common in people who have maybe asthma or chronic obstructive pulmonary disease, or could have cardiovascular disease alongside it. So it's not a clear and cut sort of condition by itself. Some people have it along with the disease. Other people may only get it when they start to exercise, maybe walking upstairs, or it could be that you experience breathing pattern disorder when you start doing higher intense levels of exercise. What causes it? It could be a magnitude of different things. It could be an illness, that may be a bad chest infection, or people who have had COVID kind of develop a breathing pattern after they've had the illness. It could be an injury. If you've injured your body, you may become a little bit more restricted in your movements. That can potentially cause a breathing pattern disorder. It could be related to stress and anxiety as well. If you're a little bit more kind of keener to kind of get air in, that can develop an inefficient movement around your rib cage, which can then lead to inadequate air reaching your lungs. The symptoms that you might experience with a breathing pattern disorder are tight chest. They can be basically not feeling you get a satisfying breath. It could sometimes you get an inspiratory wheeze, and sometimes you get things like muscle tightness around your shoulders, around your back, or pain kind of through your sternum. So there's all these kind of symptoms that might kind of bring on a breathing pattern disorder, but they are also, you might get misdiagnosed with another breathing problem with breathing pattern disorder, because those symptoms might sound similar to asthma. And so we found a lot of people with a breathing pattern disorder might be using asthma therapy, but the asthma therapy is not really solving their symptoms. So it could be they have asthma and the breathing pattern disorder, or it could be they don't have asthma, but they have a breathing pattern disorder, but they're not being treated for that breathing pattern disorder. Diagnosis of breathing pattern disorder is quite difficult, because we haven't got a gold standard test for it at the moment. So what we tend to do with breathing pattern disorders are, we need to observe your breathing pattern disorder. We can ask you some specific questions that might help underpin it. And we can also potentially do what's called a pulmonary exercise test that can look at the consistency and the depth of your breathing when you're doing increased levels of activity. There's lots of various different tests we can do to diagnose it, but a lot of the time it will be based on the symptoms that you're presenting with, and observation of your breathing pattern, whether that be using video or using kind of breath by breath technology that you would use during that cardiopulmonary exercise test. Once we've got the kind of a diagnosis or an indication for breathing pattern disorder, we can start doing things like breathing pattern training. And breathing pattern training is really helpful. But the importance is the breathing pattern training isn't just about how to move your rib cage effectively. It's also maybe bringing in things like how to hold your posture, how to become more relaxed and less stressed and less anxious. So it's quite holistic, the way we deal with breathing pattern disorders. But once an individual understands kind of what's causing the breathing pattern disorder, they can make quite dramatic improvements. It's really important to know that the breathing pattern disorders, usually they present during activity. So usually these breathing pattern disorders might kind of present themselves if you're walking upstairs, or during the hardest part of your exercise routine, and then they go away quite quickly once you stop. But once we've initiated that breathing pattern training and you understand what to do, you become much more in tune with the way that your rib cage is moving, and hopefully you can basically deliver a better breath. And if you can deliver a better breath and a better quality air into your lungs, you can then not experience those sensations of breathlessness, and you should find that you can pretty much do any activity you like without that sensation. But the key is to make sure you get a clear indication of the way you're breathing, and then what we do at the Marylebone Health Group is basically educate you how to deliver a better breath, and then you should be able to kind of exercise symptom free and enjoy any type of activity you like.